You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Super excited about this episode. We got some big news to share, I think. Ivan, why don't you go ahead and get us started?
Hey, I'm Zach, and I can't be happier of reintroducing again our guest, who is a colleague of mine, a friend, and a former competitor, Dr. Caleb Frankel. Dr. Caleb Frankel is a seasoned founder CEO of Instinct and an internship-trained ER veterinarian with a remarkable 15-year career. A veteran in a large multi-specialty hospital, ER hospital management, and new product development, Dr. Frankel has led teams instrumental in launching impactful products like Plum's Veterinary Drugs, New York Vet Show, Instinct Treatment Plan, Instinct EMR, and Instinct Scripts. His wealth of experience reflects dedicated commitment to advancing veterinary medicine and patient care. Caleb, it's great to have you here again. Thank you for joining us.
Thanks for having me, guys.
So what the heck? Why did you buy Plum? Why? What's happening? How does Instinct EMR, I assume, is going to leverage that? And what's the big plan?
Yeah, this is the big news as of last week. We're a few days into it, and I guess we'll get right into that. So I think we may have surprised some folks with this, but I think the first thing I'll point out is what most probably don't realize about the VetMedux business, which owns Clinicians Brief and Plums. And that's that, over the past several years, they've sort of made this transition from a media company to a SaaS company. And in fact, the majority of their business is now software subscriptions like us. And so, this is actually a SaaS business at heart, and that probably frames it a little bit. They make mission critical products and sell subscriptions to them so that they can constantly make them better and better over time for, veterinary caretakers. And really that's no different than how I think about what we're doing at Instinct, right? And so, I think anyone who doesn't sort of get it sort of gets stuck in the same reason why maybe a lot of the PIMS development over the past, decade or two has failed us. And I wrote this in the sort of blog post about this, but veterinary software, for those of us on the ground floor, and as you guys know, I still practice, it's no longer just some scheduling, cash register, Rolodex system or way to communicate. It's in 2024, the PIMS of the future is actually a set of critical tools that our teams use to care for our patients. I describe it literally as the filter of our care now, right? And so, when we started Instinct, our founding principles were around designing it with that in mind, right? And so, Instinct Plums Pro, which is their new product I'd love to talk about, Clinicians Brief, we think we're bringing those together to do more of that. And I think the simple way to summarize it is, we're in the business of building mission critical software tools for veterinary practitioners and in the world's leading centers. And we're bringing sort of the best technology, we believe, together with the best content so that we can develop some, transformative tools for hospitals and caretakers over the next several years.
That's super cool. Super interesting. And I think my question is very future forward. So 5 years from now, what does it look like? What is that merger, those two mission critical software? How do they come together to provide more value for your users?
Yeah, that's a great question. I think the profession needs help, and you guys know this more than most. There's no way to sugarcoat it. There is an incredible undersupply of veterinary professionals in the face of booming demand, right? And all the while, Ivan knows this well, we're burning our great people out, right? At an unsustainable rate. And this is a problem that's not going to solve itself. And, burnout in human physicians is studied pretty heavily. The number one cause cited, you guys probably know, is clerical tasks with association strongly with what they call the EMR or the EHR, right? It's not different in veterinary medicine. And in my view, it's much worse. It's just not studied as well, right? We've done some time motion studies. We spend upwards of 80% of our shift in specialty emergency urgent care centers as veterinarians in front of our PIMS. right? So if you want to have a meaningful impact, where would you start, right? And so we sort of firmly believe that, thoughtfully designed technology holds the unique ability to solve some of these problems, as silly as that sounds, right? So, to answer your question, Shawn, I'll make a bold statement. I think Instinct EMR and Plums Pro, which are, two of the products here, the newer products that we offer, could be two of the most important tools to veterinarians over the next several decades. And I think a big part of the solution to this, an actual practical set of solutions. And so we're going to be working hard at Instinct to make sure that's true. And we bring these products together in a way that helps clinicians through, what we talk about a lot, which is decision support. And I'm happy to sort of cover a little more about that.
Tell us more about the Plums Pro, and do you anticipate, I assume you do, but do you anticipate the integration between the products? Or, because in a way you talked about it just now as like we're going to have a portfolio of SaaS products, but it does seem like there's an opportunity to integrate Instinct with the Plums Pro.
Yeah, that's exactly what I mean by clinical decision support tools. So I think we're one of the few ones really laser focused on this and talking about it. But when we launched Instinct Treatment Plan, which, I think we might have covered on a previous episode, and back when you and I were, competitors and friends doing this together, we really approached it with the lens of these medical and workflow clinical decision support tools built in. So a great example is for years, we've had Plums integrated into Instinct at the point of care. And we've gone a step beyond that. So we actually developed our own content too. So we're one of the only systems that I know of in veterinary medicine that if you are in a hospital using Instinct and you go to, put a treatment on a treatment sheet with a drug that's potentially dangerous to the animal, Instinct sort of steps in and says, hey, are you sure? And we think those tools are really important. We're planning to do a lot more of that with this together, right? So you can probably start to imagine all the different ways that we can build true clinical decision support tools. So not just content that you reference, right? But things that take the best content in the industry, which we think Plums and Clinicians Brief are, and serve it at the point of care just in time when you need it to help these clinicians do their jobs better. And ultimately that leads to more efficiency, better patient care, but also something we don't talk about that affects burnout too, which is confidence. Veterinarians, they are affected by, they want to do a really good job, right? And it's getting harder and harder to do a really good job, right? And so anything we can do to make them more confident about the care they're delivering, I think is a huge win. And I think you can start to see how these come together for that.
Yeah, I think that's my question, Caleb, is just more on the Imagineering side. Imagine we're at Disney and we're building the next great Harry Potter ride, or I guess that's Universal. It's just in Florida a little while ago. What does it look like? What does it look like for the veterinarian that's saying, this vision of doing less work or having it be there for me, what's the vision? What's the bold vision of how these things come together to save veterinarians time? Because we all know they need help in that department.
Yeah, I mean, we have a reputation of building, tools like this through our treatment plan, which many know now, our PIMS, which is Instinct EMR. And, we think these tools are unique because of that. We're building innovative and bold sort of decision support tools. And some examples are embedding content when you are working on a case, right, that may serve you the most up-to-date information about whatever disease or clinical symptom that you have put on your treatment sheet or in your medical record, right? Helping provide content to educate pet owners. So Plums Pro and Plums now have some of the best peer-reviewed content that can help you educate your pet owners, written and authored by the people who are developing Plums for drugs, and Clinicians Brief and Plums Pro for content beyond Plums, or beyond drugs, I should say. So those are great examples. But then there's a host of things that we think we can develop that maybe don't even exist. So I talked about the safety warnings, so we can take that a step further, right? There's definitely ways to provide safety warnings for, drug doses, right? And you have to do it at the species level. But think about drug-drug interactions. That's another big sort of missing piece of content that could be developed at the point of care to help veterinarians be more confident. So, I think that's a great example. And then, just bringing these tools together makes things way more efficient for the clinicians. They have to look up this content, no matter what practice you're in, they have to look up this content. And if it's right there where they're doing their job, we've seen great traction at making them more efficient at doing their job. So there's a whole host of other things we're working on, and I'm happy to talk about those. E-prescribing is another big one. But I think that paints a little bit of the picture for you, Shawn.
Yeah, I think I get it. And, dare I say it, instead of just continuing to dance around it, the dreaded AI conversation, right? Like, we're talking about taking some of this work off the shoulders of people that just can't carry anymore. And so this content, which is incredible, and I'm very familiar with the content that Plums has. I think you're right. I think it's one of the best sources for this type of data in the industry. That's very valuable, especially delivered in a way that maybe is not, Big Brother, but it's like, dear friend, over to the side where it's like, hey, if you want this data, it's here. Feel free to click on the button or don't if you don't need to. Is that part of the strategy?
Yeah, I think you nailed it. I mean, as a technologist, I think, like most of us, AI is incredibly powerful. But I think what you just touched on is really insightful. And that's that as a veterinarian, I'm deeply skeptical and in touch with the reality of technology adoption in my colleagues, right? And most of the people who provide the best pet care in the world are not like the three of us. I mean, let's just call it what it is, right? They really aren't. And frankly, AI is not why any veterinarian I've ever heard of, except for the fringe, are choosing software, for example, right? And I think we just need to be honest about that. So what we're focused on is building these tools. AI is a great example, but to me, it's just another way to deliver really powerful clinical decision support tools in a way that's practical and really thoughtful, like you said, Shawn. Decision support is very well known in human health. There's a lot of studies on using AI to better provide decision support tools. And I think that is where we can start to see, big advancements that, like you said, are very practical and widely sort of embraced by veterinarians so that they can get used to this idea. And, it doesn't have to be done in a scary way. And that's sort of how we're starting to do it. And I think the best AI tools of the future are going to be powered by the best input, right? And so what's the best input? I think Plums and Clinicians Brief, you could say, are some of the best, right?
So here's another maybe a challenge that you may run into or think about it as well. As you guys were talking about AI, right now there are PIMs that are incorporating AI into their workflow, and then there are just simply ChatGPT that you can access. And it's interesting. I mean, the answer is obvious that, that if you have the data come from Clinicians Brief and Plums, that's going to be the most accurate. But the claim is there that, we have AI too. And you can press this button and ask about, the medical management. And I do that. I take the IDEXX blood work, throw it in ChatGPT instead of typing it up. Not because I can't interpret it, because I don't want to type it up. I copy paste it into ChatGPT and ask it to, summarize the bullet forms of abnormal values and give me a list of differentials. So how do you see that competing with you in almost like unfair way? Because you're on a forefront of getting the best of the best. And then, anybody can come in and say, I'm integrating the back end of ChatGPT and I can do the same.
Yeah. I mean, look, I think there's a place for all those tools. I think IDEXX and some of the other companies out there are even developing their own, and they're super interesting. A lot of them are built on the backs of, any other language model like you're describing. I think in the future, a lot of that's going to be a commodity, right? The algorithm and the language model. I think we all sort of know that, right? If you fast forward 10 years. So the big question for me is, what is going to differentiate these tools so that they can have the greatest impact? And that goes back, I sound like a broken record, but for me, that goes back to clinical decision support, meaning these tools have to be baked into the workflow to have the optimal impact. If we're spending upwards of 80% of our time in front of our PIMs, then there's no greater place for those to exist. And so we're just trying day by day, month by month, year by year to bring those into the tools we're building. And we think that's pretty exciting.
Yeah. So we know a bunch of people over at that company that you acquired, and they're amazing people. So let's talk about that. Like, let's talk about the fact that your team just got a bunch more amazing people. And not just that, but what else really excites you about the future of what you're building, Caleb?
Yeah, look, we're trying to do something completely different at Instinct, and you nailed it. The people that we get to now call Instinct teammates are absolutely incredible. So first of all, we doubled as a company overnight last week. That's a big statement. So we're up to about 138, I think, people now. We're a much bigger company. But with that, for our hospitals comes a lot more support, a lot more resources, a lot more speed in what we're developing. So that should be really exciting for them. And we think this is a really bold and transformative move at the end of the day. I mean, I've had some people come to me and say, I didn't see this coming, but this is brilliant. I think a lot of people, are sort of shocked by it, but I think a couple things make us different as a company. One is we're veterinarian led, right? Everything we build continues to be guided by people like me who are practitioners who actually are in the trenches, live and breathe the plight of the veterinarian. And second of all, we are focused on turbocharging sort of hospital operations through these kinds of tools. And so bringing these teams together, we think is really, really exciting.
So what's the next big move? What are we going to see as the product users, or because this is a big step, obviously accomplishing and finalizing the transaction. But what is the next thing that the users that are using your software are going to see? What do they have? Something to be give them a little bit of taste of what to be excited about in the upcoming releases.
Yeah. I mean, I think first of all, some of the initiatives we're working on right now are to lay the foundation. So the first thing I want to say is for hospitals who are using Instinct products, we're being really careful not to distract from the mission that we sort of want to live up to. So Instinct EMR, the full practice management system, is our fastest growing product. It's becoming widely adopted, and we know that hospitals want us to continue innovating and building into there. And that's where we're going to spend our focus. But with these new additions, these new teammates, these new amazing resources, we are going to be putting them into play. And so some of the things we're working on this year are, as you know, we have launched our e-prescribing platform. We are working on deeply embedding that into our tools so it's even better. And with that, we'll be able to put plums into our e-prescribing tools. So that's one. So that could include things like looking up drugs like we do in our treatment plan at the point of care, but also things like the drug interaction engine. That's really powerful when you're prescribing medications both inside and outside your hospital walls, right? And then I'll point out another thing, which is these high quality handouts. So in a lot of states, it's becoming a requirement that if you prescribe drugs, you have to provide a client handout. We think that's going to continue to happen. And Plums has authored these peer-reviewed handouts. And so we are deeply embedding them into workflows so that hospitals can hit their, prescribe, print out a label to a drug, and the associated Plums handout comes with it, right? That sounds small, but it is game-changing for workflow and making them compliant in these hospitals that, are run in these states. And then all the other things I talked about, deeply embedding new tools at the point of care, powered by content like Clinicians Brief and Plums. I think all those things are things that our hospitals can start to look forward to in a really big way.
That's awesome. The only thing I want to say is that I think it was the theme at the Portugal conference this year. The future is bright. So I think with people like yourself in the industry and with the moves like this, the future is bright for us. Hopefully we can automate and make more efficiency in the processes where we were spending 80% of our time and we'll be spending much less. So thank you for doing that and leading those initiatives in the industry. And thank you for finding the time to be on this podcast. As usual, we ask 2 questions at the end. One of them is there a YouTube video, book, a TED Talk, or anything else that you recently watched, listened, that you can recommend to our listeners?
Yeah, I don't think I recommended this last time I was on, but I love reading and listening to founder stories. So Walter Isaacson has some great biographies. If your listeners have not read them, or in my case, I listen to them on whatever platform you like to listen to books. But the Steve Jobs and Elon Musk ones are definitely must listens to. I love the Ben Franklin one as well. They profile, a lot of entrepreneurial, inventor, founder like stories, and I think it's done in a really cool way.
It's awesome, Caleb. Congratulations on the acquisition and the path forward. It looks bright. I think Ivan's right. Last question is another innovator, someone you think we should have on the show.
Yep, I'll give you two. So one is biased. I think you should have Elizabeth Green on, who is the founder of VetMedux. She has a really awesome story, and if you haven't had her on, she's really great. And then the second one, I don't think you've had this person on, but you really should, and that's Paul Pion. Paul Pion's the founder of Vin, and he's become a friend and a mentor, and he's obviously like a legend because of Vin, but many don't know that he also discovered the link between taurine deficiency and dilated cardiomyopathy in cats. So, but he's just got great stories about his founding of Vin, and I think your listeners would really like to hear from him.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.